Let's see NCLEX tips points video on oxygenation part 1. Patients reporting a productive cough with the following symptoms should be screened for tuberculosis. They are hemoptysis or bloody sputum, low-grade fevers, weight loss, night sweats. Tuberculosis is a highly contagious illness that is transmitted via the air. Any patient with the listed symptoms should be placed in respiratory isolation until TB is ruled out to ensure the safety of the patient and providers. Dyspnea is a subjective finding and will vary between patients. Patients who are reporting dyspnea and have any of the following assessment findings should be referred for immediate medical intervention. They are the patients who are unable to speak or able to speak only a few words, use of accessory muscles, retractions, adventitious lung sounds, tachypnea, pulse oximetry readings below baseline, abnormal percussion sounds, cyanosis, change in level of consciousness. Percussion sounds and associated respiratory conditions are like this. If the percussion sound is flat on the respiratory system, there is a potential condition which is pleural effusion. Dullness is heard in pneumonia, atelectasis and MAS, and tympani is heard when there is large pneumothorax. Hyperresonance in emphysema, chronic asthma and pneumothorax. There are certain abnormal or adventitious lung sounds related to certain respiratory conditions. So the sound of fine crackles, which is an abnormal sound, or fine rails is seen in the respiratory condition of fibrosis, bronchitis, pneumonia and COPD. Coarse crackles are observed in COPD, sputum in airway, pneumonia, pulmonary edema, congestive heart failure. Rhonche is observed in pneumonia or bronchitis. Masses or malignant can be non-malignant also, foreign body. Wheezing is observed in asthma and COPD. Stridor in allergic reaction, epiglottitis, laryngitis, pleural friction drug in pneumonia, lung malignancy and pleurisy. Certain acid-base abnormalities which are related to the respiratory system are: first one is respiratory acidosis. Here the arterial blood gas result which you need to see is partial pressure of carbon dioxide will be greater than 45 mm of Hg and pH is less than 7.35. So we will call it as respiratory acidosis, and it is associated with COPD, pneumonia and respiratory failure. Respiratory alkalosis, where the partial pressure of carbon dioxide will be less than 35 mm of Hg and pH is greater than 7.45. It is associated with conditions of hyperventilation. It may be associated with early asthma or pneumonia and anxiety. Hope you understood this video. Thank you so much. Please do keep watching for more tips and points on NCLEX.